going to talk about racial disparities. And the reason that's so important is because we know that men of African descent have really borne the bulk of the disease when it comes to prostate cancer. They get twice the risk of getting the disease, twice the risk of dying from the disease. And now you have a study that shows that they actually fare better when they have metastatic disease and are treated with some of these advanced therapies, which almost seems oxymoronic in some ways. Like, how could that possibly be? So the question is should we screen men of African descent differently, and should we treat them differently? And what is the role of convincing men of African descent to be part of trials because of how important it is to learn more about this disease who are men of African descent?
You know, I think you brought up a great point. You know, African Americans suffer from this disease more than non-African Americans, but you know, the beauty why we know immunotherapy works so well is because that trial was 10 or 12% African Americans were enrolled in this phase 4 trial. Typically, we get 3 to 4% or less than 5% African American enrollment. So I think that what the key is that you definitely have to screen and get early intervention with African Americans, but we got to really work hard to get these men in these clinical trials because, like to your point, Michael, they really suffer from this disease. And when we had a large enrollment of African Americans, we saw a huge benefit. So if we don't have these men to study and to evaluate these newer therapies with, we'll never know.
Appreciate that. Elisabeth, did you have anything else that you wanted to add as far as, you know, you're so involved with clinical trials, and I know Jason is as well for the Michigan City Urology. What do you think is the most convincing story and indication that you can tell an individual as to why they need to partake in a trial and how it's an advantage to them in the community within which they live?
You know, I think a lot of it, Jason mentioned that, you know, you do get top of the line care. You know, in general, we all try to deliver top of the line care, but it's more of early access to drugs that might potentially be successful. Now, fortunately, in prostate cancer, you know, I think back of all the men that participated in studies with all of the newer androgen receptor targeting agents. I mean, they went from having to go on some experimental treatment with no name, just a bunch of letters and numbers, to, oh my gosh, this stuff's really working, to I'm still here to talk about it 7, 8 years later. If they did not participate, I doubt that they would be here. So it is a chance. They are, you know, when you participate, you are a hero. You are being altruistic to the next person that you're going to help. Not every trial is a home run. But when you participate, it's a home run, because no matter what happens, positive, negative, you help really create the story. You help define whether a particular class of medicine is the right way to go. And I take about, what do we know about, let's say, COVID today? Think about all of those thousands of people that participated to lead us to a vaccine in record time. If you don't participate when that opportunity is given, we will never know the answer. And in particular to, you know, groups that are at some level disadvantaged, not in terms of economics or location or whatever our other disparity markers, but perhaps on biology that we don't understand. The only way to really know is to enroll. And like Jason said, if you get the right numbers and you really can answer the question appropriately and not just infer the information, you're going to move the ball down the field quickly.